Hello, welcome to another Facts and Dimensions video showing off the Facts and Dimensions data, of which there are thousands and thousands of tables covering all kinds of data sets, all open data, and the Cortex Analyst AI system which I'm using to analyze that data. And in the description you can follow a link where you can get free access for 30 days both to Snowflake and the data that we provide through Snowflake, and therefore their AI tool. So, if you go to the first video in the series on YouTube, you can see where I've explained how to do a semantic view. And you can see that I've also shown how to use a particular table in Facts and Dimensions that lists all of the values across all of the columns, across all of the tables, so you can search for which tables have data on particular terms. And there is an awful lot of data in Facts and Dimensions covering flu and flu vaccinations. And I've decided to use these ones. So there is a flu vaccine uptake for primary school kids table, and there is another table in the NHS outcomes framework of emergency admissions for children with lower respiratory tract infections, which is related to flu. In this first one, there's data across different ages, and I'm going for the all primary school age kids. And I've decided to pick on the January 2023 data to have a look at kids that were vaccinated in that 22-23 year. And then in this table, I'm looking at, because this has data by quarter, I'm looking at the lower tier local authority data, and I'm looking at that data which is for the quarter ending March 2023. So I'm figuring those kids that were vaccinated between September 2022 and January 2023, they'll be the ones impacted or not by whether or not they're going to be having an emergency admission for LRTIs, yeah? I mean, that makes sense to me anyway. So I'm filtering that data on lower tier local authorities because the other table gives us it broken down like that. And only looking at the indicator values, which is the rate per 100,000, standardized rate per 100,000. This is maybe where it's going a bit wrong, because this is standardized, including taking account of things like deprivation, which also relates to access to GPs. So all kinds of factors there. But I'm hoping in your comments you might go through the various tables we have, and maybe pick another couple of tables we should use. There was another really good one which had the flu vaccine uptake by staff, by hospital, and also the absences by type of absence by hospital. Unfortunately, one of them has data for 2024 onwards, and the other one has data only up to 2021, so I couldn't really do it. Okay, so let's go to Cortex Analyst. Now, in the first video in the YouTube series, I show you how to actually make a semantic view. And in a few months, Snowflake have promised that us data providers can actually start sharing semantic views, so we can make them and share them, and then you can edit them rather than making them from scratch. What I did is I pulled in these two tables, and I also pulled in the ONS, Organization of National Statistics, code and parent codes, so I can join them all. And then I put together the relationships relating the table with the flu vaccinations to the ONS codes, and also the emergency admissions to that same table as well, so they can be related together. And then I go through and sort of define all the codes of the tables so that this chatbot can understand it. So this is what I did when I was playing around today. List all the indicator values for emergency admissions in March 2023. So it gave me let me have a look at the data so I could have a decision what I wanted to do. Then I told it to apply the filters because I hadn't done that. Now, in each table in semantic views, you can actually add filters. You see here I've added a filter to only bring back data for January's, because I know this table that only has data for September, October, November, December, January. But for some reason, the way Snowflake works is if you don't specifically say to apply the filters when asking, it won't apply them. So you just have to say apply all filters. Right, so that's done that. Then I decided I'd also want to make it only do quarterly, and only do the January 2023. So you can see in the emergency admissions one, I put filters in, only wanted local tier, local authority, and only wanted an indicator value figures, not the lower CI, upper CI, and all the other measures, and only to do quarterly, so I'm not doing annual numbers as well. So I've asked it to list all the indicator values for emergency admissions for children with lower respiratory tract infections in March 2023, applying all the available filters. That I didn't actually write that. I just wrote apply all filters after I'd written my previous question, which was list all the indicator values for emergency admissions in March 2023. Cortex then rewrites my question in a way that it finds easier to understand and then interprets it into SQL. So I've done that. Now let's go to what was my next question that I asked further down. List all the vaccine percentage uptake values per local authority for January 2023. Apply all filters again. And it's done that as well. Only for all primary school age, because I didn't want it to do for every single different age group. Did that in the filters you see here. I didn't have to put in a filter. I could have just explained it in the question. Either way, I would have done it. So it's given me the percentages. So for example, in this local authority, in the September to January 2023, 48.6% were vaccinated. And it's written the SQL there. This is really good here because you can copy the SQL into a new screen, into a new SQL worksheet to check that you're happy with the code. And I think that's extremely important. My worry is that analysts will increasingly use this and not really check that it's done what they think it's done. So it's going to lead to a lot of lazy, incorrect assumptions. Then I ask, is there a correlation between low vaccine percentage uptake and high emergency admissions per local authority using the data returned in the two verified queries? And it's kind of done it, but it's actually returned every value. So I realised that it was doing that for a join that was going the wrong way. If I show you here, it's a bit difficult. It's written all this for me, but it's taken the local authority code from the vaccine data and joined it to the ONS code. And then it's taken the local authority code from the admissions data and related that to the local authority code in the vaccine data, whereas I wanted to relate it to the ONS code again. So I actually amended the relationship to make sure it was the correct way round, and then I asked it to do it again, and now it's done it. Now this is the local authorities, the vaccine uptake percentage, and the emergency admissions, and I've made it so vaccine uptake is going up, so it's in vaccine uptake percentage order. But as you see, as I'm scrolling down, the emergency admissions per 100,000 goes up and down quite wildly. I mean, I'd have to do some more maths, but I'm not seeing any correlation there at all. Now, it's quite possible that the way I've written this is incorrect. I'd love for people to actually help me see if it's the way I've asked the question. I did ask again, add a column with the order value for vaccine uptake and another for order value for emergency admission, so I can just see the order number. So you can see I've got a ranking for both, and it's in vaccine uptake rank from this one, very low vaccine uptake in Brent, to very high, well 74% anyway, in West Berkshire. And you can see the ranking for emergency admissions goes up and down and up and down. Now the thing is, that could be because some areas have nowhere near enough access to GP practices, and so they're more likely to rock up at A&E. There could be all sorts of reasons, and we do have all sorts of data on deprivation, all kinds of things. So I think in future videos I'll have to do some more complicated work, but that'll do for now. So thanks very much. If you want to try it out for free for 30 days, just follow the links in the description.